triggers.
Oh, yeah.
I'm feeling a little triggered, to be honest.
Really?
That was a lot going on.
Okay, there's a difference between trauma triggers and normal, typical annoyance with your parent.
Normal triggers and trauma triggers.
Well, I think
Separate
it's
things.
just a normal feeling and emotion.
Oh my God. You just have to downplay everything I say, don't you?
Wow.
Wow.
Tell me more.
Well, literally all of 30 seconds ago, you said you're feeling a little triggered to get in the... Yeah. Yeah.
Mm-hmm. Okay.
Mm-hmm. There's a lot going on. There's always a lot going on before we start with you. And you know, it drives me crazy.
It is. I feel like it's my, I don't know, mom duties to like get you irritated, get you a little sassy.
I don't know. It might be a trauma trigger every time. I hesitate going to hit record every time on the mics. I'm like, oh my God, do not start singing.
Do you feel like you're gonna die when you're with me? I mean, is this
Maybe?
There's a difference between reluctance, oh my gosh, here we go again, dealing with my mom. Anyway,
okay, so I have a question.
Yes.
Why can't it just be a regular trigger?
It can be a trigger. You can be triggered.
Not everything's trauma triggers. Sometimes it's just a regular trigger.
Just a regular trigger. Yes.
Yes.
Mm-hmm. You were triggered to having a reaction. Yes.
God. I feel... Let me tell you how I feel.
Tell us how you feel, Victoria.
Like you are very much minimizing my experience. I feel like you're being... What's the word? Facetious? I don't know. I don't know.
That's an impressive word, though. Yes.
Thank you. I don't know if that's the word that I was looking for.
I think it fits.
Like you're basically saying it, but you're also saying it in a way that makes it feel like no. You know?
Mm. Mm-hmm. Yeah, I don't know if that's quite facetious or
what
paradoxical.
Is facetious?
There's a look it up.
It was on TikTok, guys.
FACETI.
An adjective used to describe speech or behavior that is playfully humorous, flippant, or not meant to be taken seriously.
Yeah, but I always think of facetious, which I like that definition, but I always think of facetious having a little bit of a, like, yes, the fun, flippant type of thing, but a little bit of a bite to it, so...
Condescending, that's what I was looking for.
Oh, you feel like I'm condescending to you.
That's how it felt.
I mean, yeah, that's valid. I'm not trying to be condescending.
That's what it felt like. Anyways, trauma triggers. It's our second episode in this trauma series.
Yes. Although we did have a stress episode.
We had a trauma episode at one point, and I'm forgetting what it was called.
Oh, the trauma dumping and trauma trumping.
Yes, that was not technically a part of this series,
right. But we could probably put it in there. And then we had one in between, but we did talk about stress and chronic stress and what it does. And that's a big component, obviously.
But that wasn't really trauma. We didn't focus trauma related.
No, but it does have an element, especially when you think about trauma triggers specifically. One of the things that happens within the physiological system is that it activates the stress response, right? So very relevant.
It's applicable words. I said it right the first time, but you talked over me, so.
Well, I think we're near the end of the semester, into the school year, and yes, words are hard. Moods are not always completely stable. I'm talking for myself here. Right, like the fatigue, a little bit of delirium at times.
Okay.
I'm just going to stop. I'll take my cues from you.
I am taking all of this personally. All of it. I feel attacked.
I was completely speaking of myself, and
I'm using my feeling words today.
You're using your feeling words, and
all of them.
I was thinking of calling myself feeling a little unhinged.
Yeah. Anyways,
I don't know. Anybody else near the end of the school year feeling can resonate with us a little bit?
Yeah. Anyways, trauma triggers.
Yes.
What do you gotta say about them?
Well, when you hear the word trauma triggers, what do you think of?
I feel like I've said the word too much today, and it's starting to annoy me. Anyways, it has no relevance here at all. Things that trigger reactions to previous experiences.
Mm-hmm. Yeah, it's a reaction to some sort of traumatic experience, whether that's the full memory, whether it's a part of that experience, or what have you. I think the other thing to keep in mind is oftentimes the individual may not even recognize that they are experiencing a trauma reaction or a trauma trigger.
Or they do. Both are true.
Both can be true. I do think sometimes my experience, especially working with children.
You work mostly with complex trauma and children.
Yes. And a lot of now, I would say was my earlier career. The last 5 to 10 years, I've worked with a lot more adult survivors of complex trauma and a variety of other types of trauma too. But I would say that many of them do not recognize their behaviors, their somatic experiences as trauma reactions.
And why do we think this is?
There could be a variety of reasons. One, it could just be the lack of making a connection. Like, okay, well, how did that thing relate to this response? Because, making the connection. I think sometimes triggers happen so quickly. And especially in kids, it can look like they go from 0 to 60 in a hot second and you don't know what happened. And it seems like it's disproportionate to the situation. And, oftentimes when we peel back the layers, we start to understand maybe what is happening to where they're feeling a certain way. And I usually find it's not always a trauma trigger. I would say frequently it can be some sort of trauma reaction. I also find we have strong responses when we are when our negative core belief gets activated, but that's a whole different topic. And I don't believe our core beliefs about ourselves are to me, when I've done work with them, they're not usually part of a trauma with that. So I think a lack of awareness, the lack of connectivity to it.
Okay.
And for some of them, it's just life. It's just how they are.
Yeah.
And sometimes I think they start to integrate the reactions as part of their personality.
I
Like,
was thinking back to the trauma dumping episode where we discuss how some people discuss their traumas as putting their authentic self out there. Mm-hmm. That's where my mind went when you said that.
Interesting. I that you remember that. I was not pulling that out of it. So I think that there could be several reasons for that. And I may not be sort of following the same lines that you were with your thinking, but sometimes a trauma reaction is, let me put all of this out there. Mm-hmm. So that it's almost like a confessing, or I'm just going to own up to all this stuff. And that way it's there and people can choose what to do, so that that way it's the person doesn't have to sit with the anxiousness that might be associated with letting a relationship or letting an interaction unfold. And so if somebody fears somebody is going to reject them or abandon them or criticize them or whatever it is, then instead of sort of waiting and seeing and trusting that this might be a different interaction, if we're so hypervigilant, which hypervigilance is a big trauma reaction, then they could just go ahead and put stuff out there. And then then the way other people experience that person is they're a lot, or they're dramatic, or, they're oppositional, or what have you. And so I think that that's why some of these potential trauma reactions are just taken as part of a personality. And maybe they are, or this is that issue of maybe states, right? If these are trauma reactions, behaviors that we have in reaction to a situation, but yet they're perpetuated time and time again, then those states can become traits and be seen as more of a personality. It doesn't mean the person can't change those things, change behaviors, change ways that they are showing up. It becomes harder the longer that you do it, more challenging to change those things.
Mm-hmm.
I feel like that was a whole lot, and I don't know if that was like what you were thinking of.
I wasn't thinking a whole lot of it.
Yeah.
Just the connection of what you said currently with this topic and the one that we've already discussed.
Right. Yeah, I think people have a wide range of different trauma reactions. And certainly with children, we're going to see it a little bit differently, right? So you have your typical, PTSD clusters, right? The clinical, which is the re-experiencing. So we're going to see some reactions typically of nightmares, flashbacks, memories, those intrusive thoughts or intrusive flashbacks, what have you, of that event. So that's the re-experiencing. We oftentimes see avoidance, and avoidance is, they're avoiding usually the person, place, thing, so any type of reminder of the event. And a lot of times we forget people also want to avoid the feeling associated with it. And this is why there's such a high correlation between trauma experiences and substance use, because that can help with the not having to feel those things. And so, so avoidance is one of those. You've got the alterations in cognition and mood, right? So, believing negative things about themselves and so forth. And then we have hyperarousal, and that's where you'll get the irritability, the heightened startle response, and so forth. So those are what we'll typically see, for a clinical diagnosis of PTSD. But I would say, and we talked about this before, only about 20% of people who experience traumas will actually go on to meet the clinical criterion for PTSD. That does not mean, and that's something we probably didn't talk about a lot, that does not mean they don't meet partial criteria. So you can have some who are having 2 of the 4 types of criterion, and they won't meet the full diagnosis of PTSD, but they'll have partial criteria. And so we'll treat those specific things. So people can experience part of those symptomology and not the full cluster of all of those. The other thing is keeping in mind that there's a whole lot of other types of reactions that people can experience that are not part of the clinical diagnosis of PTSD. And that can be things from, aches and pains in their body. It can be we see a lot of times oppositional defiant disorder, right? So not respecting adult authority, or I'm talking specifically with children in this case, a lot of inattention. And that can oftentimes be confused with ADHD. So
what was the statistic? About
they're
10.7.
10.7.
Okay. I think it was on a different statistic.
Oh, go ahead.
No, I think it was like 17% of people who have experienced trauma also have ADHD.
Yes. The things that we might oftentimes associate with ADHD it can also be seen as trauma reactions.
Yes.
Because the whole cognitive areas, right?
But that does not mean that they have ADHD.
Exactly.
Because 17% is actually a fairly low number.
It is. And remember, misdiagnosis of trauma, especially in children, is very common.
Yes.
And it has some pretty big implications. For instance, if we're seeing it as inattentiveness, when really it is a trauma response, then oftentimes what we see is then they oftentimes get treatment for ADHD, which could be medication. It's not working right away, so they up the dose, they add another medication. And so this is extremely common with what we see. And instead, what should be happening, especially if there is any ADHD, then we should be also assessing for trauma. Because it can be tricky to tease out which is which. And sometimes that's where, if I'm working with a child, I'll be talking with the parent and I'll be explaining, we could be looking at these different things. And it can take a while to peel back the layers to try to see which it is. You know, in my experience, most individuals who I've seen with ADHD, and I'm talking children specifically, and when they start ADHD medication, there's almost like this immediate, like the kid and the parent can usually sort of like, oh, this is helping. And sometimes it's not. And that doesn't mean it's not ADHD, but it would make me wonder a little bit more. So certainly I think the integrated care, talking with the prescribing physician and the parent and the child, and really making certain that you're understanding what the child is experiencing, it is important. But it's really common. It's really common. I work with a lot of teachers, and they're sitting there teaching second grade, and and they can see the kiddo staring blankly. And, so one of the things that we're talking about is, okay, are they staring off? And is that an inattentive response where it could be ADHD?
Or a trauma response.
Which has to do more with some dissociative types of, staring off into space. The nice thing is that teachers do not need to know the difference. I usually tell them, you know what? Fortunately, the intervention is the same for both.
Engage them.
Engage their senses. That's what you want to do. You want to have them hear you, see you, start doing something tactile, movement, things like that. And once you re-engage the senses, then their attention is re-engaged. They're brought back to the present moment. And that's what you're really wanting in those situations. So we do see, memory issues, being able to recall narrative stories in a sequential order. We see that. So again, the cognition with that, those are pretty common.
We want to talk about internalized and externalized reactions, what the difference is and how they come about.
Yes, because I think this is a good way to conceptualize reactions to trauma that oftentimes are overlooked, or maybe they're ascribed different meanings, right? So externalizing behaviors, which are what? The aggressiveness,
okay,
anger.
I didn't know what you were asking me.
Sorry. So externalizing behaviors are things that are projected outward at others.
Yes. Anger. Attitude.
Impulsivity.
Yes.
Right? So a lot of those types of things, behaviors, issues with authority, and things like that. So we see this a lot, especially in what I would call hyperarousal, right? In the sense of something happens, whether they have a trauma trigger or, you know, a lot of times, especially children, children who've experienced a lot of trauma, they have a lower frustration tolerance, so they're quicker to either become hyperaroused or hypoaroused. So we'll see in this hyperarousal, they're quick to lash out, that fight, right? That fight or flight. And so that's what we tend to see a lot of times with those externalizing behaviors. Those are oftentimes perceived by the adults around them as, we usually have other words. What's that?
Behavior issues.
Yeah, behavior issue.
Conduct disorder.
Mm-hmm. Yeah. Defiant, truant, delinquent. We got lots of names for those. Mm-hmm. Whereas the other thing, and I think these are easier to miss, which are the internalizing behaviors. Mm-hmm. And
it's the things happening inside.
Yes.
In the body. You don't see it. You're probably not hearing about it.
Mm-mm. No. And I think especially in schools, you know, there's this saying, the squeaky wheel gets the grease, right? Those externalizing behaviors are sort of, they're there in your face. You're not really going to be able to.
You can't miss it.
You can't miss it.
You can't ignore it.
Whereas the internalizing, they're a lot quieter. They're shut down. So that's that hypoarousal. So we'll see that usually more the depression, anxiety, dissociation, the anhedonia, like really not caring that accompanies depression, types of things. So we see that quite a bit. And sometimes we'll use other words for it, like shy, and so forth, whereas quiet. So there could definitely be some things going on. So it's always good just to sort of touch base with that. So I think the thing is, people oftentimes want to know, and especially, you know, educators just have some of the biggest hearts and want to help. And they're like, well, how do I know if someone's having a trauma trigger and what do I need to do? And I'm like, you know,
it's different for everybody. You probably won't know.
And I don't think you will. And I don't think we have to.
Mm-mm.
I think if we go in sometimes the assumption, right? We know the statistics of how many people experience traumatic situations and events. And that's anywhere on the low end is like 27%, all the way up to 67% of children have experienced at least one traumatic event by the time they're 16. So when we do that and we make an assumption like they've had some rough experiences, I wonder what's going on for them now. And, you know, no matter what, they could be creating this wonderful, safe learning environment, home environment, what have you. But in those moments when somebody is having a reaction, that's not what they're experiencing, that safe, predictable world. Instead, they're in the back hearing the Jaws music. And so I think that can be really sort of challenging. And then, like I said, I don't even think a lot of times individuals who are having those trauma experiences or those reminders, when they're having those, I don't know that they quite recognize those in the moment that they are, you know. And so I don't think that most of the time people are aware that they're having those experiences. The work that I have done with clients is, and these are people who really want help typically, and they're really doing the work. It takes quite a bit of time for them to start sort of peeling back the layers to seeing what those really are. You know, I mean, don't get me wrong. There's some people who, and I think this is maybe more the trend now with social media, like, I'm triggered, and everything's a trigger. And it seems like it's very self-aware, but I would wonder about that. Go ahead.
Is it self-aware, or are you creating excuses?
That is a good question. And
I have like 30 different videos playing in my head from TikTok of people just screaming that they're being triggered. And it's like everyday interactions. And it's like, there is nothing about this situation that should be causing any sort of reaction.
So then let me ask you this. Do you think that those are sort of real moments that are being captured and sharing? Or do you think that those are, because we know
like
that
skits?
Because a lot of people are doing skits to...
I think most of them are real.
Okay.
You can usually tell the difference.
Yeah.
Yeah.
So tell me what you're seeing.
Girl, I don't know. It's usually like a casual something, like a normal interaction that maybe isn't going in the way that they want it to.
Right.
And so then they just start screaming that they're being triggered.
Right. So to me, and again, this is a very generalized statement without even having watched anything. And even if I did watch something, that would be such a sliver of context. So I wouldn't want to be too, diagnostic about it. But what I would wonder in those situations is that does not seem to be a helpful reaction or a helpful coping skill in the moment, right? Because the whole purpose of identifying triggers
is so that
I can recognize them, do some work on that so that I can change the way that I'm experiencing this, right? I'll give you an example.
It's not a cop-out.
It's not a cop-out, and you can't just be flustered. And the other thing is, bad things happen, right? Trauma happens to people. It is not their fault. They did nothing to deserve it. And yet, our reactions to those experiences are our responsibility.
Yes.
And so there's a level of accountability there. And so this is where other people, if I'm having a trauma reaction or if I know things trigger me, it is not other people's job
to accommodate
me to the extent that I can have no ownership. And I'll give a couple of personal examples when I'm talking about trauma triggers. Because I did realize when you children were young, and you might have just been born around that time. I think it took me a couple of years to realize what was happening, which was I realized where we lived close to the hospital. And, I would find myself having these like automatically getting irritated and sort of shorter, which I had twins, sleep was, in between sleep. But what I finally started realizing, like, what was going on, because I'll always do my own work, right?
The helicopters.
It was the sound of the helicopters. And I realized, because I was flown in a helicopter for the boys' birth, that was a trigger for me. And so that level of awareness, okay, now that I have that. And so then it's like I'm paying attention to it now, like, yep, there it is, and noticing what's happening in my body. And then what I chose to do is that when I heard that, I then changed. So I still had my reaction, but what I did is I'm a very spiritual person. And so I started adding a prayer for that person who and their family who was on that in the helicopter at the time. And so that was a way for me to cope in those moments. And so now I can hear them and I don't get triggered. I still offer up a prayer. We don't live as close to the hospital, so I might not be
fly
as
overhead every once in a while.
They still do. But that was a way that, I didn't even realize it was happening. But when I did, I'm like, why am I having these? And then I could start pinpointing. And so now that I do that, then I was able to add an adaptive skill that tied into my personal values, something that I felt that I had control over. And that's part of what I would say is healing with that. There was another example. Oh, and so talking about ways that we can accommodate, and I know I'm going to say this, and I don't want these, I don't want to have these types of reactions, right? Which is, oh, I know where your mind is going.
Where's your mind going?
Well, I was starting
usually when I hear, I don't want to have these kind of reactions, it's usually when we're in the car and she's losing her mind over the fact that there is a car 6 car lengths ahead of me tapping on its brakes.
So I was starting off with a different trauma response or trigger that I was having. But then the minute I said that, I'm like, oh, I know where her mind went. Yes. So yeah, I think car accidents are pretty common. Yes. And most of us, if we've been in a car accident, hopefully everybody walked away and survived. But that right there, most people can understand, right? Which is that slight memory that you're having for a split second, right? That you go off the side of the road a little bit, that you're correcting, you're fine, or whatever it is. Like we're pressing on the imaginary brake, where our heart probably stops a little bit or is pounding harder.
She's vocal.
Y'all, I do a lot of that. I know, and I'm so sorry.
That's her quiet version.
It's my quiet version. And there are days where I am much better, and I think with anyone, and we need to understand this.
There are days where I tolerate it more.
I think when we are more tired, more stressed, not feeling as physically well as we typically are, then we tend to have probably stronger reactions. Like we don't have our full bandwidth to help us manage those moments.
Mm-hmm. Anyways, where were you going?
So where I was going with the other, right? We're just like, I'm putting it all out there. Some of my own experiences. We talk about not having other people accommodate us to the certain extent. And I do believe that's true, but, and I think sometimes when we know what is happening, right? Because a lot of times when we are having trauma reactions, it has set off the alarm systems in our body, and it's activating our whole sympathetic, parasympathetic nervous system, which can be taxing on the body, right? So that's why we have to learn to do our own work, whether like breathe through it or whatever works for us. But the one thing I have realized that has become more so for me is being in hospitals. And I know most people do not, it's not a place that most people want to be. Yeah. And I get that. And, but when, I think for me, having watched my infant son be bagged multiple times and, so you hear those alarms going off, when the alarms, or when he, he was having surgery and, they're running and calling for the crash cars. Like you can hear all that beeping, and so I think that certainly stays with you. But then I think, this was, I don't know how many years ago it's been, watching your dad flatline and, being moved out of the room, but I'm still within
2017.
It was 2017. Yeah. Yes. So we're coming up on 9 years now. And, but so I know he's flatlined. I can hear, and I'm moved out and the team is in there doing, and all I can hear are the beeping. And and just your whole body just changes, So for me, going in and visiting people, I will still do it. I am not And this is where we have responsibility, right? Like, of course, I'm going to go see my loved ones, family, friends. Like, that will never stop me from showing up and being that kind of person that I want to be, right? Because those are my values.
But she's not sticking around longer than she has to.
And when my sister volunteers to stay overnight, I will bring dinner. I will be back in the morning. I will bring you breakfast. Like, those are things. So I don't could I do it? Would I do it? Absolutely. Right. Like I will do it. But if, when it's my mom and if my sister wants to do it, then great. Mm-hmm. I appreciate her so much. That doesn't mean if a loved one, knock on wood, was there that I won't do it. It's just,
if someone else is offering, she's not arguing.
Yeah. But that doesn't mean if you're if you are I don't want to we're just all going to be okay. And I will be at the hospital no matter what. I just think we have to be aware. But this is why, when you like the whatever, the Friday the 13th movies, the horror flicks or whatever. I do not want to activate my system in that way. I can just feel it for hours afterwards. No, I don't want that.
No, but she loves a good Criminal Minds episode.
Oh, yeah. Oh, that's so relaxing. Because it's all going to be okay in the end.
People still die.
Well, people die, but they get the bad guys, and they understand.
People are still dead.
Well, yes. Yes, but not the main character that you've gotten to know.
Mm-hmm. They always end up saving one in the end.
They do. They save that one.
Okay.
Yes.
Mm-hmm.
It's the ones that you didn't get to know and you're not too invested in.
Right. Yeah.
Right? I'm thinking, what's the one? Silence of the Lambs. Right? The lady in the well. She made it.
That's we the only scene that I have seen from that movie is a lady in a well.
Really? We have not watched that together?
Wasn't there a dog there too?
There was.
Yes.
It's a dog.
Yeah, that's literally a 30-second clip of that.
Mm.
Yeah.
Yeah. So, I don't know. But no, we enjoy that.
She loves Grey's Anatomy, hates hospitals.
I know. That doesn't bother me when
the beeping there.
No, not
the crash carts.
No.
The people dying.
It's a tumor, right? This is our sick tumor, right? We got a headache. Yeah. So, I don't know. I think this is...
I think that's a great example of how triggers work. They don't always make sense. And you can't always change them. Okay, so in my trainings, one of the things, I have a little cartoon or a little comic strip that's has a picture of the dog. Mm-hmm. And it's don't understand it. Every time the dog goes postal every time that guy walks up the door. And it's the mailman. Yeah.
Well, of course. We know dogs bark when the mailman comes up to the door.
Yeah.
Anyone comes up to the door. Yeah. Things are just triggers. And it just is what it is. So getting mad at the dog sometimes is not always helpful.
I was so lost there for a minute. I'm like, okay, but what are we talking about? For no reason. I was lost for no reason there. It was self-explanatory. It was spelled out right in front of me.
I don't know. I'm doubting my lack of my clarity in my discussions here. So we'll see. So, I think it's interesting too that when you are in situations and you're noticing something doesn't feel quite right, or you don't like how, what your thought or response is, to me, those are opportunities
to explore, to grow,
now,
to do some deep inner reflection.
Wow. What was the definition of facetious again?
Yeah.
Yes.
Anyways.
So I think people have to be in a certain place to do that type of work, right? I would have to be in a place where beyond being stable, right? So I think a lot of times we go in what I would say 3 different phases, which is survival, stabilization, and sophistication. So when you're in survival mode, you don't have time to be processing or noticing those kinds of things. Sometimes we are just getting through the day and barely hanging on by a thread.
Mm-hmm.
And so that's typically not the time when we're going to do a lot of work on those reflective types of things. Those are the kinds of things that's like, let's just try not to have our trauma reactions
through to tomorrow
cause any more issues for yourself.
Yes.
Right? So if I've worked with some kids, like, how could we maybe not haul off and hit someone when you're in those moments? When you hit that stabilization and you're feeling more grounded,
you can start digging in a little bit.
I think you can definitely start recognizing those and like, oh, there's something there. But I'm telling you, like, when things have been stable and what I would call more that sophistication, that's when you can really.
That's where you grow.
It is. Yes. That's and so that's where, like, take those opportunities when things are going well and you're noticing some things, like, lean into it, get to know yourself, do some more of your own work, because we all probably have those triggers or those things. So a lot of times, like, especially when you're in those spots, I don't want to just know the thought that you had before that feeling. I want to know the thought before that thought. And I want to know
the thought before that thought of that thought.
And I want to know the thought that you're having.
That thought and that thought and then of that thought.
Not just going back sequentially. I also want to know the thought that you're having about that thought, which is where we really raise that metacognitive awareness.
We want to know about every thought ever had, even including the thoughts that you have about those thoughts.
Yes.
Yes. And the thoughts that you're having at this very moment.
And the emotions that come up and that get triggered by those thoughts, or the thoughts that are getting triggered by the emotions, whichever.
Yeah.
Egg, chicken,
Which came first?
We don't know. Thoughts or emotions? The emotions or the thoughts, sometimes simultaneously.
No, that was a serious question.
A lot of times.
About the chicken and the egg. No, about the thoughts and the feelings. Which came first?
I'm going to go with the idea of creation, which would assume that the chickens were there first. Just like an Adam and an Eve were there first before there was an egg.
But are you sure that they weren't created in the form of an egg and hatched as a chicken?
I am not certain. I was not present for this. And I'm not giving it that much thought. I'm just going to imagine that, like, I don't know, an Adam and Eve chicken were hanging around and...
Okay, but my question... I was thinking about the caveman theory that I had a couple episodes ago, right? This is the time where Victoria takes over and spews a whole bunch of nonsense, in case you were wondering. My question is, where did the chickens go during the caveman years?
What do you mean? Why did they have to go anywhere? Why weren't they just running around?
Have you seen chicken fossils from that long ago?
Yeah, I think we called them dinosaurs.
Okay, but then those are dinosaurs. So then what came first, the dinosaur or the chicken?
I think evolution. They evolved.
So they evolved into dinosaurs and then they evolved into chickens.
I have no idea.
Again?
We are going to get some dinosaur guru, like people that know all this research. And I'm not saying chickens are an evolution of dinosaurs. I'm saying I do not know. I am sorry. My biology teacher, I'm sorry, Mr. Morris. I don't know these things very well. I did try to learn.
didn't do too well in biology.
I did not. I wanted to, but
I didn't have a great teacher either. So.
I preferred the literature classes taught by his wife. So Mrs. Morris, yes. That was more my cup of tea.
I'm not a history buff. Just not. It's not my go-to.
I love history.
I'm not a science buff either.
I think if you like to understand people and the social aspects, and I think that's why I like literature and reading.
I don't like literature or reading.
But we didn't have TikTok back in my day. Like, you study people in the reels.
Yeah.
We didn't have that back in my day.
I'm judging.
We didn't have reality television back then.
I don't watch that. You're not going to catch me watching that. Anyways, that might be a good segue into characters we've seen have trauma reactions.
Yes. Because trauma reactions, there's the wide range. And so, yeah, which characters stand out to you?
I'm trying to remember from the list.
We have Grey's Anatomy.
We've got Grey's Anatomy. What? Grey's Anatomy. Yes. Meredith Grey.
Yes.
We've seen it from a couple of times, actually.
Right.
The plane crash.
The plane. Yes.
Yes.
And the ferry.
The ferry.
She's had several near-life death
experiences. The drowning. Yes.
Mm-hmm. Right. So the flashbacks were big.
Her entire childhood. She's got lots of flashbacks from that. Yeah.
Yes. She, especially dealing with her mother. So maybe you can resonate with her.
Her mother was very high achieving.
Yes.
Yes. Maybe. Yes. Anyways. Harry Potter.
Harry Potter.
We saw that with the Cedric Diggory? I don't know his last name.
I think so.
Yeah, I think it is. Mm-hmm. His death. I'm not caught up. Haven't seen it recently, so I don't know exactly what his reactions were, but we know that there were some there.
Definitely.
Who else?
I think Law and Order SVU. Olivia Benson, there was quite a bit.
Never seen it.
We watched it for a long time there for a while, then got out, so I catch glimpses of it. Of course, I love her as an actress.
Mm-hmm. I think there's lots of different shows.
There are. And I think especially from what I tend to see a lot.
I mean, do we see any in Criminal Minds? Probably.
Oh, we did. Spencer.
Yes. Thank you.
And he was using
substances,
which is a very common trauma reaction in those. So we saw that. I want to say even, oh my gosh, I'm going blank on her name, JJ. Mm-hmm. She had quite a few flashbacks, especially the beating that resulted in a miscarriage. Mm-hmm. Mm-hmm.
Yes. I think there's lots on TV.
There are. And I think
show writers really like to put the characters through things.
Right. And I think with that, a lot of times, especially the showing the intrusive memories or flashbacks are easy to do in stories.
But you don't get to see them in real life. You don't get to see that happen for a person.
No. Mm-hmm. You have to ask.
Yes.
Or find out what's going on with them. With children, trauma reactions, we're primarily going to see this through their behaviors. Mm-hmm. And again, they're not going to understand all of those things. Whereas adults, we might understand it a little bit more with like, oh, this is like, we might recognize when we're going through that, like, oh, you know, I'm jumping quite a bit at that loud noise because of the loud noise that I experienced during this one event or what have you. Mm-hmm. So startle responses are very common. Irritability, you know, so especially any change in behaviors, we're going to want to really pay attention to. So, and I think that that's something as parents that you can be watching for, but then also your friends, like, you know, if you're seeing that they're just not quite themselves, that they're having some of these experiences, then, you know, supporting them like, hey, I'm really worried about you. Like, I've heard that these can be some really common trauma reactions. So maybe seeing if you can get some professional help.
For sure.
Because the sooner the intervention, then the more likely it can be amenable to the treatment. Mm-hmm. Right? So remember, changes in sleep. That's going to be the first thing I'm watching for, y'all. If you are not sleeping after a trauma, please.
Sleep and eat.
Yes, and movement. Those are the 3 things. Especially we want to get those back to baseline as soon as possible. And if not, please get help right away. And then if you're having the flashbacks or intrusive memories, finding yourself being more irritable or not caring about life as much, then those are all signs that your reactions, while normal, may need some attention and maybe the help of a professional.
Mm-hmm.
And I would also say, I don't know, what would you tell people to look for if they're looking for a professional? If one of your friends came to you and said, hey, I'm having some trauma reactions, I need to have help, where should I go?
I think that's different because I know of places that they could go depending on, and I probably have people I could recommend.
And we can do I think we should, in this series, we're going to do a whole section on what to do. Trauma healing, right? Post-traumatic growth is so important too.
We'll see what we do in this series.
We've got this. For me, I tend to want to refer, what I tend to tell my students is
someone who's qualified, first and foremost.
Someone who's qualified, please. If you're being treated for trauma, please go to a mental health professional. I know life coaches are popping up, and I think that they can be helpful in achieving a goal, right? Yes. Like a behavioral goal. But typically, if for a mental health issue or trauma response,
I'm going to want somebody qualified.
And so
typically,
I am usually wanting somebody who's trained in multiple trauma interventions for trauma. And it usually means that they're trained in, at the very least, EMDR, eye movement, desensitization, reprocessing. That does not mean that they have to use EMDR, but that should be one of the tools in their tool belt. I typically am using, most all of my trauma treatment involves 2 interventions, which is EMDR and I usually start off with SPARCS, which is structured psychotherapy for adolescents responding to chronic stress. And yes, I also use SPARCS, even though it's designed for adolescents. It can be used with adults too. With its kids as young as 8, it works well with. And so, because SPARCS integrates DBT, dialectical behavior therapy, which is really important, but then also it has a traumatic grief component to it. It taps into safety and relationships and understanding the body's reactions and so forth. So it's really good to tap into a lot of those when we're especially setting sort of that safety and stabilization before we start really processing trauma. So those are things that I typically want to look for in a clinician or would refer to somebody.
Yeah.
Yeah.
Takeaways. What you got? Trauma triggers.
Trauma triggers. I think with this, it's really about being aware and sort of noticing when you're having a reaction that's not aligned with who you are and being willing to dig in and do some work on yourself when you are in a space to be able to do that.
Yes. What about you? My takeaways. Trauma triggers are your responsibility. They're not a cop-out, and they're not things that other people need to adapt to.
All right.
Yeah.
Very good.
Bye. Bye.